A young newlywed was enjoying her life when her health took a drastic turn. She's fighting a rare disease that is slowly starving her to death. She's chosen to put her struggle out there to help with awareness, but a warning, some of these images may be disturbing.
This is my favorite picture of you. This is when he first saw me walking down the aisle.
Life was normal when Lisa and Patrick Brown married in 2010. But then Lisa started having trouble eating. She couldn't keep food down.
It's just a little discomfort in the beginning.
She began losing weight, slowly at first, then alarming, dropping 30 pounds.
I was saying we got to do something. There's something going on.
This is Lisa now. Her life revolves around what she needs to do to stay alive. Intravenous feeding 20 hours a day. Doctors finally diagnosed Lisa with SMAS, superior mesenteric artery syndrome. One of the major blood vessels branching off Lisa's abdominal aorta has narrowed, blocking food from getting through the small intestine.
That's probably less than 0.1% of all people.
That's about 400 cases of SMAS in the world, according to Dr. Matthew Crow, director of surgical endoscopy at the Cleveland Clinic, where 14 patients like Lisa have been treated. Dr. Crow performs a laparoscopic procedure, creating a new path for food to bypass the blockage. But he's finding the body takes a while to adapt to the change.
Patients will lose 20, 30, or even 50% of their total body weight before diagnosis. So you can imagine it's kind of a cycle that's hard to break.
Lisa hopes to have this surgery here in a couple of months, but meanwhile, her health is still declining and she's at a dangerous weight.
89 pounds.
She's using the energy she has to raise awareness about this disease, documenting what it has done to her.
It was very cathartic, for me to accept myself and for the public to see what this disease is.
And hangs on to hope for a medical solution.
I don't fear death because I don't put that in my vocabulary.
At one point, Lisa was able to eat again. A surgical procedure helped for a few months, and she even put on some weight, but her symptoms came back worse than before.